Good afternoon, everyone. So I'm Dr. Soni, and I'm so glad everyone could join us here today to talk about dry eye, one of the most common things that we see uh, in our clinics. And our presentation's title is the FAQs of dry eye syndrome, or FAQs of DES, and we'll get started. So the first question is, what exactly is dry eye syndrome? It's very commonly used term that's thrown around, but what it really is an abnormality of the tear film. And the tear film is the layer that sits on top of the cornea, the front clear part of the eye, and that tear film moisturizes the eye. When you have abnormality of the tear film, you are missing one of the layers, or you have an abnormal amount of each of the layers of the tear film. There are three main layers of the tear film. So if you look at this red line, as we go from the right to the left, we're going from closer to the eye to farther away from the eye. The red represents the cornea, which is the actual physical front clear surface of the eye. The first layer is this greenish depiction. That's called the mucus layer. That lubricates the eye. The second layer is the aqueous layer, or the liquid layer of the tears. And then the third layer is the lipid layer, or the oil layer of the tears. The oil layer reduces the evaporation, or uh, it keeps the tear film intact. And so, as I'll mention later, when you have the tear film intact, that's when you get the best lubrication of the eye. But if any of these layers are abnormal, then you can start to have some dry eye. So, what do you feel when you have dry eyes? You can have burning of the eyes, sharp pains that come all of a sudden and then go away right away. You can have what we call foreign body sensation, which is when you feel like there's a grain of sand or hair in the eye, but it's, there's not actually that. There's also brief periods of blurred vision. So you might be reading, and after about 10 minutes or so, it starts to get really blurry. You have to take a break, and then it improves the vision for a short time again, but then it gets blurry again. You can have tearing, and you can have lack of tearing. You can also have morning stickiness, or the sensation like the eyes are hard to open in the mornings. What do we see when you have dry eyes? As an ophthalmologist, what do I see under the microscope? So we see clogged oil glands. That's one of the things. So on the left is a picture showing normal oil glands. So the oil glands of the eyelids, of the eyes, sits on the eyelids right behind the eyelashes. So you have a line of oil glands in the lower eyelids as well as the upper eyelids. This is just showing the lower eyelids here. The normal oil glands produce oil that's the consistency of olive oil, basically very loose and easily able to spread over the surface of the eye. However, when you have oil gland clogging, or another term, meibomian gland dysfunction, you can get oil that kind of looks like toothpaste as it comes out of the eyelids. And these are really clogged oil glands in this picture. We also see green dots on the cornea. The green dots represent spots of dryness, where the surface of the eye is sort of rough. And in this picture, it's pretty significant, pretty severe. And that's another thing that we see. You also have low tear production. We can see that through tests. So it's a little hard to see just under the microscope, but there's a test that I'll get into a little bit later called the Schirmer's test, which collects your tears and actually tells us how many tears or how much tear production you have. Sometimes you can get incomplete eyelid closure, or the eyelids just don't close all the way. This can happen if sometimes it's more prominent if you have a stroke or if you've had something called Bell's palsy. And then some people, even if they don't have those conditions, can have a little bit of incomplete eyelid closure as well.
Come on, now why can't I hear?
So who gets it? So many people, most people who have dry eyes, there's not really anything else going on, no other medical problems that cause it. But the risk factors for dry eyes are age. You know, over 50 years, you're much more likely to get dry eyes. If you live in a dry environment, such as Southern California, right where I am, you can get very dry eyes. Some patients say, "Oh, when I go up to Seattle to visit my family, I feel fine, and then when I'm back in Southern California, it feels very dry," and that's a very common thing. You can also get more dry eyes as you have hormonal changes, such as during menopause. And thyroid disease. Thyroid disease is very common, and that can lead to dry eyes. There is a connection there. And as I mentioned, there are other diseases that affect the rest of your body that can cause dry eyes, and those are autoimmune diseases. Autoimmune diseases, an example of that is rheumatoid arthritis, and another example is lupus. So those are other diseases that can lead to dry eyes. So when we think about dry eyes, um, many patients come in and say, yeah, my eyes are dry and I think I have dry eyes. But a lot of times it there are other diseases that could feel like dry eyes. So I'm going to go over those as well. So one of them is allergies. Very, very common. Allergies can lead to burning and also, itching is the main thing that happens with allergies, but there is an overlap between dry eyes and allergies. If we don't treat the allergies, then we're not really going to be doing you any good. If we keep just lubricating the eye, we have to have a different treatment for allergies. It can also be a condition called pterygium. In this picture, this is called a pterygium, which is a growth that goes onto the cornea. It's a very slow growing process, but that is very common in areas with a lot of sun because it can be due to years of sunlight exposure, and that can cause irritated eyes, a lot of the same symptoms as dry eyes. Another one is misdirected eyelashes. So in this picture on the left, you can see that the eyelashes are normal. They're kind of splaying away from the surface of the eye, which is this. And in misdirected eyelashes or a condition called trichiasis, you can get eyelashes to start to curve towards the surface of the eye and touch the surface of the eye. And that can feel like there's something, that's causing dry eyes, but it's actually we need to manage these eyelashes in order to help with that problem. So here's a photo showing eyelashes, coming from other glands, and that's called dystichiasis, but that's just another way that eyelashes can start to hit the cornea. Another thing that can feel like dry eyes is if you have something in the eye, an actual foreign body in the eye. In this picture here, there's a little shard of metal that's in the eye, and that needs to be taken out, or else it's just going to keep feeling like there's dry eye and lead to infection. So it's important to see if that's actually what's going on. Usually, you don't just get a piece of metal in the eye, but from doing nothing. Usually, it's work related, or you can get like other things in the eye that you really feel all of a sudden. So if you have dry eyes that has been there for a long time, it's probably not that you have something in the eye, but it is worth looking at if it's a sudden onset that you feel like there's really dry eyes. Another thing that can happen is loose eyelids. That can cause the sensation of burning and a lot of the same symptoms as dry eyes. Loose eyelids can happen due to just age related. As you get older, you get a little loosening of the lower eyelid. It's called ectropion. And what happens is this eyelid is so loose that when you are sleeping, the pillow can rub up against the inside part of the eyelid, and that can be very irritating to the eye, and that can make you feel like your eyes are very dry. The other condition that can cause loose eyelids and is not age-related is something called floppy eyelid syndrome. And in this patient here, you see that the eyelid is so very easy to flip. When that happens, again, it's the same thing where the pillow can rub up on the inside part of the eye, and it can cause very dry eyes, especially in the mornings. So a lot of people come in saying, is there any tests that you can do to see if I have dry eyes? Now, there are a lot of tests that are used for research purposes to monitor, how dry patients' eyes are, but often those tests don't really lead to improvement in clinical care. There are tests that measure different, molecules that are and different markers of dry eyes, but really it doesn't contribute to the management of patients with dry eyes. Doesn't really help us too much. But there is one test that I do use that does help, and that's called the Schirmer's test. This is a very old test, actually. And what we do is we take these little strips and we numb the eye first, so you don't feel anything with this in the eye. We take these paper strips and we put them in the lower eyelids, just right behind the lower eyelids in both eyes. And we wait 5 minutes. And in that period of time, the tears kind of drip onto this piece of paper. And if there are not a lot of tears, then the tears will stay closer to the eye. And if there are a lot of tears, then the tears will go down farther from the surface of the eye. And we can actually read the amount of millimeters that the tears go away from the surface of the eye. And there are certain levels that indicate whether your eyes are very dry or whether your eyes are not very dry. In this picture up top, the blue represents how much tears have come away from the eye, and this is showing that there's insufficient tear production. And over here, it's showing that there's sort of medium amount of tear production, and over here, it's showing that there's a lot of tear production. So we usually use this to find out if you have a decrease in the amount of tear production. Now, how do we treat dry eye? So there's no one-size-fits-all treatment for dry eyes. We really like to take the patient and take what kind of symptoms you have, your environmental exposure, all the history that you provide us, and we like to take an individualized approach to treating dry eyes. And so I'm going to go over a little bit of how we make those decisions as to what treatments to use for certain kinds of dry eyes and certain kinds of patients. We really try to treat based on the cause of dry eyes for each patient, and also based on how much your dry eyes are bothering you. If you have signs of dry eyes and you tell me, well, I don't really feel anything, then I'm less likely to say that you need any treatment. I would just observe and let you not have any treatment for dry eyes. But if you have a lot of symptoms of dry eyes and it sounds like you have a lot of dry eyes, but you don't have too many signs that I see, I would treat you for dry eyes. So it is a combination. We make that decision together, the patient and myself, to figure out whether you need treatment for dry eyes. So if the problem is the oil glands, and we really look at all the different layers to see where the problem is. If the problem is in the oil glands of the eyes, then the first thing that I recommend is something called warm compresses. So that is, our pictures are not quite showing up, but I'll just describe it for you. It's basically applying heat to the eyelids. As I mentioned, when you have clogged oil glands, the oil doesn't flow out and kind of looks like toothpaste. When you warm up the oil glands, it allows for the oil to break down a little bit and be more like olive oil than the toothpaste. And so warm compresses can help heat up the oil glands. Also, eyelid scrubs. So this is another method to allow for the oil to be a little bit more loose in the eye. And that's typically I recommend baby shampoo because it's a little bit less harsh on the eyes. And what you do is you take a little baby shampoo, usually in the shower, it's easiest, and you scrub some baby shampoo and you lather it up with water and you scrub it on your eyelashes with your eyes closed in the shower for about 10 seconds. And what that does is that breaks down the oil and it can be very helpful for some patients. If that does not work, we typically move on to more medical, treatments for dry eyes, and oftentimes a low dose steroid eye drop can help decrease some of the inflammation or that irritation of the eyelids that can happen. One of the things that you may have heard of is blepharitis. Blepharitis is inflammation of the lower eyelid or of the eyelids, sorry. And when you have blepharitis, it clogs the oil glands and it decreases the amount of oil that is in the eye. So the steroid eye drops can decrease the inflammation and it allows for better oil production. And the last sort of the other thing that can be helpful, very helpful, is doxycycline. That's an antibiotic pill that is, we typically use a very low dose of the antibiotic pill. Antibiotics can affect the oil glands and help decrease some of the inflammation as well. So what if it's a low liquid tear production problem, which is the layer that can evaporate. Typically start off with artificial tears. These are just basically like replacement tears that have a temporary effect usually. If you have very mild dry eyes, they can be helpful. If that doesn't work, there are other eye drops that are prescription based that we can recommend, and they decrease the inflammation that's associated with dry eyes. One of them is called lifitegrast, and another term is Xiidra, which is the brand name of it. There's also cyclosporin or Restasis. These are different drops that can be very helpful if artificial tears are not helping. Tear duct plugs are very useful in my practice, and they treat the low liquid tear production type of dry eyes. What that is in your eyes, you have a system where the tears are produced and then they're drained away. This area right near the nose is where the tears are drained away. Usually the tears are produced and they hang out in, if you can see the arrow that I'm moving, they hang out in the lower eyelid area and they drain away. What we do with plugs are we put these little silicone or rubber pieces of it looks like a little cork that closes off the lower eyelid tear drainage. Sometimes we close off the upper eyelid as well if it's very severe. And that makes it so that the tears can't drain away as quickly. And you can imagine that allows for the tears to build up here and makes it so that there's more tears available to lubricate the surface of the eye. And this can be very helpful, especially if the other treatments have not worked. And the good news about this is that we can put it in, and if it doesn't work, we can remove it. We can take it out. So it is, and if it does work, they can stay in for years at a time. So it is a very beneficial treatment. Now, there's another possibility of what causes dry eyes, sleeping with your eyes slightly open. So that's that exposure picture that I showed you earlier. Treatment for this, usually it's artificial tear ointment. So it's not just a regular artificial tear, but it's almost like a Vaseline for the eyes. And you put it in your, right behind your lower eyelid. And you want to do this right before you go to sleep because it can really blur the vision. So, but it can be very helpful, especially if you have exposure of the eyes at night. You also want to turn any fans that are blowing into your face away from your face. And when fans blow onto the surface of the eye, it can cause rapid evaporation of the tears, especially if your eyes are staying open at night. The other thing that you can do is eyelid taping. This is if it's more severe. If none of these other treatments are working, you can basically tape the eyelids closed, and some people do very well with this. Some people don't like it because it can cause irritation from the tape. And then the other option is something called moisture goggles, and I have it pictured here. So it's like a soft goggle that goes over the eyes, and it blocks out the light, but it also keeps keeps these little chambers that are right outside of the eyes, and keeps things moisturized. It also blocks the fan from hitting the eyes as well, and so that can be very helpful if you have exposure. The other thing that can lead to, it's very common, is if you are not blinking enough. That can technically is exposure of the eyes and can lead to tear evaporation and dry eyes. So a prime example of this is if you work at the computer all day long. Our bodies sometimes, when we get very focused on something, they forget to blink. And so you can get a lot of dryness from that. And what I typically recommend if you're having symptoms from being on a computer for a long time is something called the 20-20-20 rule. The 20s in this rule are, the first one is, what you want to do is you want to take a 20-second break from what you're doing. The second one is every 20 minutes. And just to relax the eyes, you want to look about 20 feet away. You can also close the eyes. You can look away for 20 feet. But going over that again, it's every 20 minutes of working, take 20 seconds and look around 20 feet away so that you decrease some of the strain from really trying to look at something up close for that period of time. So if it's not getting better, there are other treatments that we can use. One of them is called, sometimes we need to try a lot of different treatments, and sometimes it's just that we need to give it a little bit more time. And this is a process that we'd work on together. Sometimes we can use a thing called serum tears. And serum tears are, it sounds interesting, but it's what we do is we take blood. You do go to the lab for this, but you take blood and from your body, and we spin it down and take the clear part of that blood, and we mix that with artificial tears. And what that clear part of the blood does is it allows for a lot of different factors that you have in your blood that can be very beneficial to the surface of the eye. There are a lot of growth factors, a lot of beneficial things that can help the surface of the eye heal. One of the things that it can do is it can help treat hypersensitivity of the cornea. There is a kind of dry eye where you don't really see any signs of dry eyes at all, but the cornea is just a little bit more sensitive than the average person. And serum tears can help calm down that hypersensitivity, and it can be very beneficial if nothing else works. If there is an associated autoimmune disease, like I mentioned, lupus or rheumatoid arthritis, I recommend all patients work with the rheumatologist to try to get better overall control of that disease, because that can help with the dry eye too. So, common question, is there a cure for dry eye? Dry eye typically is chronic, so it is something that lasts, it can come and go, and as I mentioned, in different environments it can feel better than others, but it can last, can be chronic. It's all about managing your symptoms. So there are certain things that will work long-term for patients, and sometimes things that used to work are not working anymore, and we need to make a change. So this means that we do have to, most of the time, be doing something to treat dry eyes as long as you have symptoms. And it's not necessarily curable in that sense, but it can definitely be managed very well. So I want to go over what to expect if you do have dry eyes and you want to get checked out by us. So what should I expect on my first visit? So typically the first thing that we do is diagnose the disease. we want to make sure it's not any of the other things that can cause the sensation of dry eyes. So once we do that, we initiate the first treatment, and that treatment is selected based on what kind of dry eyes you have, whether it's due to the oil glands, the liquid gland, part of the tear film, or if it's due to the eyelids staying open. So usually we want to do one treatment at a time so that we know what actually works and what doesn't. If we do 2 or 3 things at one time, then we won't really know which one actually works. So that is a very important part of our treatment. After the first visit and after starting the treatments, then what? What happens then? So the second appointment, I'd like to give it about 1 to 2 months of really trying the first treatment. And then if you feel better, then we continue that, what you're doing. And we usually check up around every 4 to 6 months to make sure things aren't getting worse and make sure we don't need to change the treatment. If it's not better, then we try a new treatment. And there are a lot of different options for it. The important thing to know is it might take a lot of visits to find what is actually the working treatment for you. So it does take a little patience. That is my presentation. So I want to conclude on just a general overview of how we approach dry eye treatment in our clinics. So just want to go over the recipe for a successful dry eye treatment. So we want to find the correct cause of dryness, make sure we're treating that underlying cause. We want to use treatments specific for that cause and try one treatment at a time. And then we want to have a pinch of patience as well, because sometimes it can take a little while to find the right treatment for you. All right, and that concludes our presentation, and I want to take this opportunity to open it up to questions from any of you.